Good afternoon. I am Gail Gray with the City of Columbus Department of Neighborhoods. It is my pleasure to welcome you to our first ever virtual Lunch and Learn. The 2020 Lunch and Learn series is focused on a women's journey in Columbus. Each session explores barriers facing women in the community and how each of us can contribute to reducing gender discrimination. This year's series is focused on women as a way to recognize and commemorate the 100th anniversary of the 19th Amendment that gave many women the right to vote. I would like to thank our partners, the Columbus Women's Commission and the Women's Fund of Central Ohio, for joining us to co-convene this series. For the Department of Neighborhoods, this conversation is so important because of the work that we do to help Mayor Ginther's vision be seen in Columbus, for Columbus to be America's equal opportunity city. The Department of Community Relations Commission is focused on helping residents understand and navigate the protections against discrimination that exist. This work is important so that all Columbus residents can live with dignity, understanding, and have mutual respect for one another. I appreciate Community Relations Commissioners Alice Poirier and Helen Yee for helping to organize today's session. I also want to thank Kelly Grismer for serving as our moderator and each of our panel members for volunteering their time to share their knowledge with us. I know this will be a very engaging discussion. As we have taken steps to prevent the spread of COVID-19, we have unfortunately also an increase in domestic violence and child abuse. I am grateful to all of you who are joining this conversation on Facebook Live. I encourage everyone to reflect on what you learn and consider how you can help. If you are watching today and need assistance, a number you can call will be posted on the screen. It is now my pleasure to welcome and introduce Dr. Osweiwu from the Women's Commission, who will be sharing remarks today. Thank you very much for being here, everyone.
Thank you, Gail. Thank you, Community Relations Commission, for hosting these important conversations and for focusing on gender for this year's series of Lunch and Learns. We are thrilled to partner in this work, both through these events and as commissions of the city, together listening to the needs of our residents. As you mentioned, I am a commissioner of the Columbus Women's Commission, and I am an obstetrician and gynecologist practicing here in Central Ohio, and I am grateful to be part of this conversation. The commission was first announced at the mayor's inaugural address in 2017, created from the leadership and passion of Mayor Andrew Ginther and First Lady Shannon Ginther. Today, we have 24 appointed commissioners who guide, inspire, and steer our work. The commission has a clear mission: achieving economic security for all women in Columbus. We do this by raising awareness and driving policy change. We focus on 4 areas: health, workforce development, housing, and pay equity. The conversation today is more important than ever. Domestic violence is on the rise because of the COVID-19 pandemic. As we have shelter-in-place restrictions, many victims are being forced to shelter with their abusers. Domestic violence impacts a woman's health and her economic security for a lifetime. Intimate partner violence is the leading cause of injury to women in the United States. As we continue to move the needle and focus on policy change, it is important to address domestic violence and understand its impact on our community. Changing the story takes courage. Changing the story takes everyone. Thank you, Community Relations Commission, the Women's Fund, and the city for the partnership. But most importantly, I want to thank all those who are here to learn and work together for the women in Columbus. I would now like to introduce Kelly Grismer, President and CEO of the Women's Fund of Central Ohio.
Thank you so much, Doctor. As the CEO of the Women's Fund, I'm so happy to be here to help moderate this conversation. We're, of course, very supportive of what the Department of Neighborhoods and the Community Relations Commission has been doing to eliminate discrimination and remove the effects of past discrimination, issues that are very important to us as we create social change focused specifically on gender equity and gender equality in our community. And of course, this year, we're particularly honored and humbled to be part of the focus that is directly on women and the progress we've made and the progress that we certainly still need to make. And we really believe that this issue of domestic violence is one that's often misunderstood. It is certainly, and I know personally, an issue that deeply affects public safety and public health of both women and men, but as you just mentioned, a majority women and their children. And, but we think that people often miss the fact that it is also very much about economic empowerment, that women are often in these situations because of economic empowerment that they don't currently have and can't find a way to improve. And even women who are economically empowered are often disempowered once they get into a relationship that involves domestic violence. So it is very key. We know economic empowerment is absolutely key to gender equity and equality. And we know that domestic violence is one of the most insidious reasons that economic empowerment is so difficult for our gender. So I'm proud to be here and happy to moderate this discussion and do want to turn the mic over to Andrea Boxall at Columbus Public Health so that she can kick off our discussion.
Thank you so much, Kelly, and Doctor, as well as Gail. This is a great opportunity, but it's an unfortunate opportunity. It's one you never really hope to participate in. But I don't take it lightly, and I feel like the more that we talk, the less secrets that can be held, and the safer the rest of the community feels. One of the things I like to do is always caution when we have these conversations that some of this discussion can be difficult. And not only the topic is difficult, but some of the words that are used. And so we want to be conscious about those words because words have power and we know it. Also, there might even be a heightened sense during this conversation of being triggered, feeling threatened. And at the end of this we're going to provide you with a list of resources. Even yesterday, we had some things come out, you know, the city attorney has a text line. You can always call 911. You can always go to Choices. And it started a bigger conversation for me. And the conversation was, what if I don't have a phone? What if my abuser makes sure that I don't have contact with someone else? Let's start talking about creative ways for individuals to seek help. And one of the things that came out, someone said, well, most of our people don't have phones. And I said, it doesn't have to be an either or. And a lot of times when we have this kind of activism and movement, we think that there's only one way. The key to this is we need choices. We need an opportunity to decide what is our best way and the most efficient way. So I was listening to NPR yesterday, and it was a conversation about domestic violence on the increase in some places around the world, 80%. In some places, 6%. On average, whether it's Colombia, Uganda, China, Spain, England, United States, we're averaging a 22% increase in calls. So we can't let this very tragic situation be lost. We want to take advantage of this opportunity. What they're doing now is, in England and France, what they do is they call it Mask 19. The few places that women can go often are to do those things that support the household. Do laundry, go to the store, go to the pharmacy. So training those entities on if a woman comes up and says a code, what that really means to help her secure safety. I really think that given how severe this is and what our mounting data is suggesting about domestic violence during this time, it's shocking, but here's what I found yesterday, okay? So there's a timeline of domestic violence, a timeline that begins since the beginning of time. So while there's nothing new under the sun, the approach that we take is what has to be new and different. And I think this conversation, even in this venue, is an opportunity for us to reach out to some people. Domestic violence perpetrators rely on isolation from friends, co-workers, and family and neighbors. So when you have a government mandated sanction like what we're going through now, for a perpetrator, the control is beyond everything. It's beyond the household. So we really have to do some in-reach versus outreach during this time and use some very unique channels in order to do that. I think our guest panelists today are going to give us some information and some opportunities that are really going to build a system of care that isn't siloed by an agency name or a funding stream, but is much more about, if you can do it, I can do it. And if she can't do it, this agency can do it. We have to provide a network of care that's beyond even a government dollar to some degree. So I thank you all for this opportunity. I thank you for joining. If you have friends, one of the things I always suggest, because usually with Facebook Live, you can go back. So make sure today, every one of us, including myself, I'm going to post this conversation for others to go back to and review. Thank you so very much. I appreciate this opportunity.
Thank you, Andrea. And thank you to all of you who are here on the panel. Before we get into introductions, the one thing that I want to say is that if anyone's listening right now and has a concern of immediate danger, you can call or text 911. Call or text 911 if you have access to a phone. And if you don't have access to a phone, we will be trying to provide additional help throughout this call. So the first thing that I'd like to do then is that we have experts on this panel who really need no introduction with regard to their work, but I'm going to ask them to briefly introduce themselves and where they work and briefly how they fit into the DV domestic violence networks in our community, and then we'll get into some questions. So Denise, would you like to start?
This is Meg Dennis, and I'm a manager at SARNCO, the Sexual Assault Response Network. Oh, darn.
That's okay, everyone. Why don't you just, I know some people we might have some challenges with sound. So Meg, why don't you go ahead and introduce yourself if you can, and then we'll move on around the panel.
Okay, sorry. My name is Meg Dennis. I'm the manager of SARNCO, which is the Sexual Assault Response Network of Central Ohio, where we respond to 24/7 local helpline, statewide helpline, and hospital response when a survivor presents to the hospital for care.
Thank you. Denise?
Hello, everyone. I'm Denise Contras from the Ohio Domestic Violence Network. We are a coalition that supports 75 domestic violence programs throughout the state. To help you understand the scope of domestic violence in Ohio, last year, our program served 82,000 survivors, and about 12,000 of those were children. Also, about 9,000 survivors stayed in shelter. In addition, our crisis calls exceeded 100,000. Part of my job is to develop the continuing education for the training curriculum and the online learning academy. I've been in the field for over 20 years. I'm a lifelong resident of Columbus, and our city is very, very special to me.
Sue? Would you like to introduce yourself?
Hi, I'm Sue Valillo. I am with LSS Choices for Victims of Domestic Violence. Choices operates a 24-hour crisis hotline that is available to anyone in need. We also offer a shelter for victims fleeing violence in their home, as well as some community-based resources, including individual counseling and community advocacy. We have peer support and education groups as well throughout the community.
And I believe we will be providing all these numbers that we'll be referring to throughout the call or throughout the panel. So we will provide that information. Lara, would you like to introduce yourself?
Hi, everyone. I'm Laura Downing. I manage the Victims of Crime program, which is in Community Refugee and Immigration Services. So we are a team of multilingual advocates that works with survivors, victims of crime in Central Ohio who have limited English proficiency, and we provide community-based advocacy services.
Thank you. Helen, would you like to introduce yourself?
Hi, everyone. My name is Helen Yee, and I'm representing as a commissioner for the Columbus Community Relations Commission. And this is a very serious topic, and I would like to share a bit about some safety preventions today.
Okay, great. And Mary Lynn, would you like to introduce yourself?
My name's Mary Lynn Caswell. I'm the director of the Domestic Violence and Stalking Unit for City Attorney Zach Klein. And we prosecute domestic violence and stalking crimes, provide advocacy in the courtroom. We have 16 advocates, and then we have a specialized team of prosecutors who prosecute those cases.
Thank you, everyone. And I thank you so much for being here to share your great knowledge and expertise with all of us. Andrea set it up well with regard to the fact that certainly we all knew that domestic violence has been an issue, frankly, since the beginning of time. And it's something that our community finds very hard to face because it's difficult to talk about. It does involve personal relationships that we often find difficult to invade in each other's lives, and yet the people in these situations are so isolated that we know we need to be finding ways to reach them or let them know what resources exist. In the current environment, as Andrea said, we are not where we were 6 weeks ago with regard to being able to move around together in this world. And certainly there are people who were previously isolated who are even more isolated and facing probably a more difficult situations than they could have ever imagined, even at the most worst 6 weeks ago. So tell us what this pandemic, from your view, what you're seeing, why, what existed, how it could have possibly become even worse, even though we well know that that's what's happening. And anyone can start if you want to even put up your hand and let me know that one of you would like to start. All right.
I don't know how to put up my hand.
Okay. Yeah, you can even just wave it at me there. That's great.
Okay. I was looking for something more technologically advanced.
No.
Okay. But I will start if you don't mind. I will say at Choices, we have been monitoring our hotline calls on a daily basis. And what we are noticing pretty consistently since mid-March is that we are getting fewer calls actually placed by victims. We're getting more calls from the police, which is wonderful. And we know that the police are following the protocol that they are to follow when they go on a domestic violence run. But we are seeing fewer calls from victims. And I think that speaks to Andrea's point earlier, very difficult for folks who are sheltering with an abuser to get to a phone, to make that call, to have any type of external communication. So that is one concerning part of this pandemic that we've been seeing, as well as for the victims that are getting to us and are getting through, typically through the police. We are seeing increased violence in the episodes that are resulting in them getting assistance. So we're seeing more people who are really struggling with a harder situation, more violent situation than they had previously dealt with.
Mary Lynn?
Yes, so along with what Sue was saying, we are seeing through the police an increase in the number of domestic violence calls to the police. About 3,226 calls were placed last month, which is about 600 calls more than average. And we are still open. The police are still making the same arrests that they've always made. They're donning their PPE and coming to scenes, and they're still administering the lethality assessment protocol. And we are still having arraignment court. It's just on Tuesday, Thursday, and Saturdays. Our regular dockets are still open and running for defendants who are incarcerated. That's Monday, Wednesday, Friday. The domestic violence and stalking unit for the city attorney's office is open every day, Monday through Friday. So you can come in and talk to an advocate or call us on the phone or text us. We do have a new text line that we've implemented since the COVID crisis, and I'll get that out at the end. And we do know that even if you don't have access to a phone, often an abuser will damage or break the phone or monitor the phone. know while things are limited, it's definitely more stressful, more difficult. We are still available and we still can help you get shelter and help. Texas Order Court is also still open every day, 8 to 2 o'clock, Monday through Friday for intake, and the court is issuing emergency orders.
Go ahead, Meg. Thank you, Mary.
With respect to sexual violence, our helplines, both local and statewide, have had a marked decrease in calls for sexual assaults for survivors or co-survivors, and our emergency room response has more than 30% decrease in terms of survivors presenting to the ERs and the local 18 adult emergency departments. So our calls are all down as well.
Is there anything else that anyone else would like to add about what you're currently seeing before we get into a little bit more of what the actual cycle is, at least as we had seen it, and how that may be impacted, how the cycle we've come to know for domestic violence may be being impacted by this current dynamic? Anything else anyone wants to share? What? Yeah, go ahead, Laura. Yeah.
I just want to say that for our program, since we're all working from home now, we've also seen what other people are saying, which is that we're getting less calls overall for new clients. We've pretty much seen a drop off of all crimes other than domestic violence because we serve a wide array of crime victims. And then we're also focusing a lot more on just helping people meet their basic needs. So delivering food boxes, getting them connected to internet for their schools and things like that, which a lot of refugee and immigrant communities don't always qualify for some of the other assistance out there. So a lot of our resources lately have been spent making sure that they have information about COVID-19, translated into their languages, and making sure that they're still able to reach those basic needs during this time, a little outside of some of the stuff we normally do on a daily basis.
So I think what's interesting is that all of you are mentioning, I think we should talk a little bit about domestic violence and how we often would have counseled people prior to this happening, because, you know, many of you have mentioned having hotlines, and that's I think that's under the assumption that there would normally be some time during the day that a person afraid of abuse could find, either from their own job or while their abusive partner is at a job, or even, as you said, while they're running to a grocery or otherwise, they might have a moment to make a call, to talk to one of your departments, or even to call 911. And in this current environment, we have pretty much encouraged people not to do any of those things. And the jobs aren't even open for people to move to during the day. So maybe talk a little bit about why you have counseled people, you know, why the hotlines worked, and what you're seeing now, and how we are trying to help people if they can use a phone but aren't able to. They have a phone but aren't able to use it. What fixes we're trying to come up with to still get access to and reach in, as you said, as opposed to out. Sue, would you like to start with choices?
Yes, I'd be happy to. Thank you, Kelly. So one of the things that we have been talking a lot about is the importance of friends and family members and keeping lines of communication open with the loved ones that you're concerned about. Not necessarily talking to them about the domestic violence you fear is occurring in their home, but just being that presence for them, so that if they are in a situation where they need help, you are viewed as a safe resource for them, and maybe you are able to reach out on their behalf if they're not able to have a conversation on the phone with one of the hotlines, or even to text to get help. But that's really where looking out for those you love, those you're concerned about, really comes into play, and is especially important right now.
Yes, Denise.
Sue, I'm really glad you brought that up about the importance of friends and family. There is a resource that is being posted. It's a guide to family and friends, and it has great talking points about having a conversation with a friend or loved one who you think may be abused. So I'd like to encourage everyone to take a look at that.
Just to let everyone know too, that we will have we have a Google Drive where we will be sharing a lot of resources that all of you will be able to access after this call. So we know that you're listening and maybe not being able to get everything down, but we will be sharing that. So normally, I think it would be great if one of you could talk about sort of the cycle of domestic violence, how we know it's, for people who don't have as great of an understanding of how domestic violence plays out in people's lives and why these family relationships can become so strained for those of us that want to help people. Maybe some of you can talk a little bit about what you know about the cycle, and since we've already talked a little bit about how we know that cycle is harder to communicate about right now. Yeah, Denise, go ahead.
Yeah, there are a lot of misunderstandings and myths concerning domestic violence, and we like to work with two definitions. One is the legal definition defined by the Ohio Revised Code, and Mary Lynn can certainly speak to that. And the other is a broader definition. It's what we call a social definition, and this is the one that is used with social workers, counselors, advocates, and it's also a definition that we share with victims and survivors so they really understand what's happening to them. DV is not an isolated incident. It's not a private family matter. It's a pattern of coercion and assault behaviors that
Is someone's not on mute, or is that you? Is that you, Denise?
No, it's not me.
Go right ahead. Sorry.
Okay. So DV is a pattern of assertive and coercive behaviors that one partner uses against another. And what's important to recognize is that the goal of the abuser is to control all aspects of their partner's life. And they do this, they can use physical or sexual violence, they may or may not, but they do this through threats, intimidation, and different methods of control. Every situation of domestic violence is unique, but abusers or batterers, and I'm going to use those terms synonymously, use very similar methods, and these tactics usually intensify and increase over time.
So I think that's important for people to realize too, that domestic violence doesn't always start out physically and can very much be about emotional and mental abuse, especially in the earlier portions of relationships or even in the cycle of a relationship. It can go back and forth. Sue, I saw you raising your hand. Would you like to share some things?
I would. I love what Denise said, and I want to add to it that as part of that power and control that the abuser may or will exert over their victim, isolation is one of the primary tactics. So really helping or eliminating or reducing the relationships that that person may have with friends or family that would be supportive of them. So right now, during this pandemic, when we're sheltering at home, that is just a new tool in the kit that abusers are using to take control over their victims by enforcing the stay-at-home order in a way that's not healthy and keeps the victim even more under the abuser's control.
And I imagine, Sue, the other issue is that normally that abuser in some relationships wouldn't be there all day long because they may work somewhere else or they may both work in different places. In this instance, they've been given the opportunity to actually keep a harder eye because no one's leaving the home for separate, or many people are not leaving for separate workplaces, correct?
Yes, you're absolutely right about that. That is definitely a key to what's happening right now.
Meg, I couldn't tell. Did you have something you wanted to share?
Just that the current environment, the added stress from unemployment, it intensifies things at the home. The stress of not having money for food on the table, etc.
Yeah, that's such a good point, Meg. Thank you for raising it, because I think a lot of people don't realize that we also, when you think about domestic violence, you know that things even like the Super Bowl tend to increase domestic violence because there is so much cultural emotion and sometimes anger or stress over something like that. So one can only imagine that in a situation like this, those emotions, anything that's outside forces on these already tense relationships makes it worse. Can you talk a little bit about why, what you've seen, what are some of those times of year or things that exacerbate domestic violence and would only be further exacerbated by this pandemic? Go ahead, Meg.
Oh, okay. So I'd say times of the year like Christmas and social events, and where there's like a lot of family and stress comes with family, financial stresses, there's usually a little bit of an increase in incidents. And then of course, with all the testosterone at Super Bowl time, like you mentioned, things like that is what I would say. And during low economic times.
Yeah, so the economic stresses certainly add to this as much as the public health issues that we're all facing. Has anyone had any experience with regard to or having have any advice with regard to how family members? I know we talked about family members being so important, and I know someone even mentioned Andrea mentioned the code words. Are there things that family members could be doing that we know that people could be looking at people's phones or watching their computer screens or looking through their email to see what they're doing or saying to others? Are there, I know Mary Lynn probably could also help us with safety planning. So maybe all of you could talk about some of the things you would suggest that would allow people to provide a way for victims to be reaching out for help, even though they're not trying to be obvious about it. Yeah, Helen, go ahead. And then Mary Lynn. Helen first.
Yeah, Kelly, that's a good point about having other family members or friends that could be able to support in some way without making it so obvious. So maybe the victim can go for walks, and if that's allowed, within social isolation protection, but maybe being able to talk to them and having those key safe words or phrases that could be shared in times of need. The other thing is, just always leaving that open lines of communication in some way, checking on them consistently and regularly, whether with the phone or somehow letting them know that there's support there for them.
Yeah, and a lot of times I know that family and friends can feel a certain amount of anger themselves with the situation. And I think we really need to encourage people to, especially in this situation, even if you're feeling your own personal emotions about why this is happening, that shouldn't prevent you from reaching out to these people and letting them know that you're there for them, regardless of maybe even the pieces of this that you don't understand. Mary Lynn, I know you wanted to talk a little bit about this type of outreach from friends and family.
So we work when we work with survivors. We're talking about using a code word to your friends or family. So you could it could be whatever it is that you work out, like a text or a call, or maybe if you live in close proximity, something that you put on the porch or something that would indicate like, hey, I need some help. Can you, whatever it is, stop by? Can you call the police? If I text you this word, that means call the police. And when we ask, we provide our text number to survivors. We suggest that they delete it. And if they're sending that text that to us, we'll reach back out to them at an email address or wherever that's better for them to have some kind of conversations, but to kind of erase that trail as best that they can. And I think you were talking a little about the economics, and I think it's remiss if we don't discuss housing too. Like the leading cause of homelessness for women is domestic violence, and that's particularly difficult now. So if you have a situation where maybe you would retreat to a grandmother's house or an aunt's house or somebody else's place that you could go to, you don't feel safe going there now because maybe they're a high risk person, or maybe you can't travel to where you need to get to them. So I think the other friends and family options, even those options seem limited to people. And with what Sue was saying, not only are we seeing an increase in violence, and domestic violence cases coming through the police, but we're seeing the level of violence or the intensity of violence is more severe. And I think that it would be remiss to not talk about that survivors are concerned about calling the police because they're aware that that COVID's in the jail. They're aware that they're increasing their family's exposure by having this person arrested. Ohio's a preferred arrest state. So it's an internal and an external conflict for people. And I think we need to do whatever we can in any way that we can to collaborate, to reach out to people and say that we're going to do what we can to get you to safety.
Yes, Meg?
I would also add, just if someone reaches out to you as a domestic violence survivor or victim, to meet them where they're at, and they don't always leave the relationship, and that's okay, and to provide information so that they can start to acquire resources for when they do finally plan to leave, but just being non-judgmental when they don't leave the relationship, and how can we safety plan within staying in that relationship as well.
Yeah, I think that's really important. And so I'd like to, for a minute, talk about if someone is concerned that they might be seeing that either they might be in an abusive relationship and they're not sure if it's an abusive relationship, or if you're seeing a friend or a family member go through this, what are they looking for? And how do they then react to that? Maybe we talk a little bit about we've talked a little bit about how they can reach out, but let's talk a little bit about what they're looking for, and also what the cycle of the violence is, because to Meg's point, it's probably not realistic for us to assume that most people, when they first realize they're in this type of relationship, that they will leave for a variety of the reasons we've been talking about. So let's start with what it looks like and how people know if this is likely something that they should be paying more attention to. Sue, I know you've been nodding. No, that's great. That's great. Yeah. Unmute. We just need everyone to hit their unmute when they go to talk. So it's up at the top of your screen. Is everybody stuck? Denise, can you unmute?
Yes, I can.
Great. So what are people looking for when they're concerned that people might be experiencing domestic violence?
Well, as we've talked about it, isolation is a key factor. And if you check in on a friend, either text or call, and they put you off right away or say, I can't call right now, or this isn't a good time, that could definitely be a warning sign as well. And we have to realize, as Meg said, we want to meet the survivor where she is. Domestic violence is never the victim's fault. So I think it's really key to continue to offer help in a very non-judgmental way.
And sometimes I know you'll see injuries or things that they will have made up a different excuse for. Would any of you like to speak to sort of when there is an injury, how people, a person will characterize those injuries to try to hide the fact that something's happening? Denise, did you have?
That is very, very common, because they know if the abuser finds out, it could even be worse. And in some cases, victims know if the police are called after the call, they themselves will endure even more physical or sexual violence. So that is something to abusers, typically will escalate the behavior, but survivors are in a position where they need to comply for their own safety or the safety of the children. But compliance never means acceptance. Another thing I think an idea would be to observe the children, see how they're acting. children are much more than witnesses to domestic violence. They're often traumatized by the event. Children may be acting out, they may be becoming difficult, they're suffering from trauma symptoms. So I think another way to approach a family would be to observe, talk to the children.
And Meg, did you have something to add on that front?
I was texting away to you. Our educators, that opportunity of seeing children in the schools, the educators like are 70% of the folks that recognize domestic violence. And we don't have that option right now because everybody's being homeschooled.
Right. So I think some of the things I'm hearing you say are, is if someone has an injury, whether it be a bruise or, if it doesn't add up, how that may have happened, or if boy, this person seems to be falling on the stairs quite a bit. That is one thing that you could be looking for. And also these cues from the children and others. Laura, I saw that you raised your hand.
Yeah, just to add a couple things, especially that pertain to refugees and immigrants, things that you can look out for, other signs of this control that generally permeates into most areas of that person's life. In a lot of situations where maybe the abuser speaks English and your friend or family member doesn't, if that person is always the one interpreting for them, interpreting in doctor's appointments, at the bank, if it seems like that person always has to have permission or run things through that person, when they're very capable of doing those on their own, regardless of the language barrier. Also things like them holding on to that person's immigration documents, or sometimes we see when one person has US citizenship or legal permanent residency and the other person doesn't. A lot of times that is because the abuser has intentionally made it that way when they could have adjusted that person's status, because that's also an extremely powerful tool to control somebody. So those are just some extra ways that you see show up with refugees and immigrants.
Yeah, and Laura, it's so important too, if you would talk a little bit about, many of us are probably a little more familiar with how the American society has been learning about and trying to talk about domestic violence. What are some of the differences you see in the new American populations in our city, in our country, that we may not be thinking about?
So everything that people have said about the cycle of violence and coercive control also pertains, of course, to refugees and immigrants. But typically there are some added barriers for people to get assistance, get help, and access resources that they need for many people. And everyone has a different situation, but just some of the additional barriers involve language. So being afraid to call the police, sometimes because they don't know if the police are going to provide interpretation, or if they're going to use the abuser as an interpreter, or a child in their home, or a neighbor, or just ask them to call somebody on the phone, or just not be able to provide that police access. And those things are usually pretty valid concerns, so that we often see that not happening when people call the police. And then, of course, there are a lot of other fears around calling the police. If you have fears around your immigration status, and abusers often capitalize on that as well to say, if you call the police, you'll be arrested, you'll be deported, you'll be separated from your kids. I can call and have you deported at any time. So they have that additional tool for controlling you through fear. And a lot of times, again, if it's a situation where the abuser speaks more English, then it's very easy for them to sort of manipulate those situations when you are reaching out for help. Because it's a lot easier for people to talk to the one that speaks more English. So we've seen things like the English speaker saying, oh, she called the police because the television was on too loud and she was just angry, but really, I'm just the victim here. She's abusing the kids, or something like that is very common. Fears around immigration status makes people scared to reach out to any kind of resources because they might not know who they can trust. So being able to reach out to organizations where they know that services are going to be confidential. And if you use an interpreter, making sure that the person is comfortable with that interpreter and they're a qualified interpreter. Also, other barriers are just like lack of familiarity or knowledge about systems, the justice system, medical systems, school systems for their kids, because they're just not familiar with it, especially if they haven't been in the US for very long. So they don't know what's out there, what resources are out there, what their rights are. In different countries, wives might not have as many legal rights as they do here. That's, of course, not always the case, but that abuser can then capitalize on that as well to say, if you leave me, I'll get the kids. You know, I'll leave you with nothing. You don't work, so I'll automatically get custody of the kids. You know, that sort of thing. So there's a lot of sort of added potential tools for abusers to use and barriers to getting those resources that they need.
Thank you. And I think that, you know, as being at the Women's Fund, that is one of the things that concerns us the most is that, you know, societies generally are not set up for women to be empowered historically. And we're certainly working on that as hard as I know we all are. But I think that people need to remember that through the lens of these other countries, cultural differences may make it even harder for a woman to be empowered than what we see here, and that will only further complicate. Denise, I see you raising your hand, and then we need to get to a few points before we finish.
Certainly, yes. Laura and Kelly, you are absolutely correct about that. I would like to add that any domestic violence agency or program that receives federal funding is required to accept immigrants and refugees and not ask about their immigrant status. Also, they are required to offer a foreign language as well as American Sign Language interpreters.
Excellent, thank you. That's very helpful. So the first thing is that if any of you are out there, there is the ability to submit questions. So if any of you would like to submit some questions here for the end of our session, we'd love to hear from you. You can type the questions into the chats or the Facebook, and we do have someone monitoring that. So please feel free to go ahead and submit those. And I know we want to talk now, as we have a few minutes left before we get any questions. Meg and Mary Lynn, I'd like you to talk about, there are some types of violence that, first of all, some people may not think are lethal. Meg, I know you had a thought about that.
Yes, I'm also a forensic nurse in my past life, and strangulation. If you were to ever have a survivor come forward and disclose to you that they were strangled, not choked with food, strangled, there can be hypoxia, and that's really a high indicator of lethality in terms of, is there been damage done in this incident, but the next incident could be highly lethal. So I would strongly urge you to consider asking that survivor to consider going to medical care.
Yeah, so you don't want to ignore, just because they are now breathing, the fact that they were strangled is something that could be very important to know. And I will also say that just because you can't see injuries doesn't mean they're not there. Abusers are very good at creating damage in places that aren't necessarily seen, you know, on legs and arms that are often covered. Especially, I would imagine in the new American population, that based upon cultural dress, that could be an issue as well. Mary Lynn, could you talk a little bit about what you would see, what the city attorney's office, or, you know, what we have that's available to people legally if they do need significant protection and are afraid or don't have any understanding of what might be available to them?
Sure, absolutely. I do want to follow up on what Meg was saying in terms of the strangulation. There's a bill pending legislation right now that would make strangulation and domestic violence a felony. We do still take that to the county prosecutor's office on a case-by-case basis in terms of what the medical evidence would support to enhance that to a felonious. But I think it's critically important that people understand that the strangulation, as you were saying, Kelly, has injuries that are not seen externally. It is the leading cause of strokes for women that are, or any young person, that's the likelihood that they were strangled, is my understanding from the medical people. So we really encourage survivors to get into the emergency room, because you're going to need some very specific tests. It's not just somebody looking through. It's not, are you no longer hoarse? Did you stop vomiting? And are you able to swallow? Okay, it's more in depth than that, and it does need to be evaluated by a medical professional. So really encourage that, even if you're feeling better. So, and in terms of the second part of your question, in terms of protection orders, if you have a criminal charge filed, you can come to the city attorney's office on the day that that person is arraigned. That would again be a Tuesday, Thursday, or Saturday, and you can seek an emergency domestic violence temporary protection order, and the court will handle that matter first thing that morning. We'll reach out to you, the city attorney's advocates will, via text or phone call, or usually both, the day of or the day before the arraignment. If you prefer to pursue a civil protection order or a civil stalking protection order, those court systems are currently open. Our advocates here, I know both at Choices, at Chris, I know other advocacy agencies all throughout the state of Ohio will be able to give you information, and you can still walk through that process either pro se with an attorney. Many advocates are still taking survivors over to those courts and apply for your ex parte hearing. You would be heard that same day if the court hours are still in, but you want to get a plan to kind of where you're going and making sure that you know where you're going and you have the right paperwork to get there. And then go ahead and you'll have to have your stuff kind of in order, and then they will give those orders out. The judge will make a ruling on those the same day. So they're setting out the hearings, the follow-up hearings a little bit later, but they're still moving on with those. Those are seen as emergency court business, and the court is open for that.
So I think what's important for everyone to hear from that is that, you know, that there is a system that's designed to address these kinds of claims, that understands it does start with calling the police and being able to have a charge that everyone's acting on, and that these hearings happen, and that, but you can also call these hotlines that we will highlight, and people can help walk you through if you're not in a situation where there's a charge that's pending or some kind of legal proceedings have been initiated yet. There are a number of resources we'll provide to everyone that they can hear. And I do see that we're getting some questions now, so I'm going to go ahead and go to that. And we will mention those numbers before we finish today, I promise, for everyone. So let me see. I think we are the person on our line, Pedro, has been monitoring calls, and I believe he's able to help us hear the questions. Is that right?
Yes. Hi, everybody. My name is Pedro Mejia. It's been wonderful to hear everyone so far. And as Kelly mentioned, we do have a couple questions from the audience. The first question comes from an individual who asks, and first states, "Thanks, ladies, for all you're doing to keep women safe during this crisis. Are there any materials that we can share with our networks, constituents, to inform women where and how they can seek resources during this crisis if they feel unsafe? Are there materials we can share that will provide guidance to other individuals who suspect DV in another home?" So I believe this question is specifically asking about a resource during the coronavirus outbreak.
Anyone want to start? I know many of you were nodding, and I know that we do have a Google Drive where documents, resources will be available. I know Andrea maybe had helped with pulling that together. Do you want to speak to that, Andrea?
Yeah, so we at Columbus Public Health have not stopped our functions of the Women's Health Clinic and the Sexual Health Clinic, and even our dental clinic. So many of our services are still open. So I would strongly encourage, and we also have social workers on site, even if it's saying, "Hey, I want you," it's the person who's being victimized, "I need you to go with me if they're able to go, because I need support. I need someone to walk in with me." And then explaining that it's an opportunity for them to get linked to services. Sometimes being the person who's in need can take the shift off. So Columbus Public Health is still open. We also still have our Saturday clinic. I would encourage going online, but not everybody has broadband or a computer. So certainly you can call my personal office line, and I'll get you linked as well. And that's 614-645-0803. I'm over the Alcohol and Drug Services Division, and we know that the exacerbated use of drugs and alcohol is there. One, out of boredom and isolation, and two, it is an unfortunate, but it is a coping skill. And we've actually had an increase in overdoses as a result of that. So we can connect you to all of our different arms within the health department. But as I said, we partner with every agency. I'll call Sarnco. I'll I'll call the Domestic Violence Network. It isn't about us, it's about getting your needs met.
Yeah. Would anyone else like to highlight any resources? I know we all have numbers. Maybe I should share those numbers. Yeah, go ahead, Meg.
Our advocates respond to hospitals for sexual assault, and we're now responding to domestic violence during COVID. But it's a telephone response where our advocate will be on call, and then they'll call into the hospital and be transferred to the survivor's room, and they can provide resources and support during that time. Just wanted to add that.
So let me share as well at this point, just as resources, that there is a Choices 24-hour hotline at the shelter that is monitored. That number is 614-224-4663. And anyone can call that hotline for guidance. The city attorney's office also has a number, 614-653-8075. That's not for emergencies. That is just for this guidance regarding domestic violence. Again, text or call 911 if you are in immediate danger. Helen shared that Bravo has a number, 1-866-862-7286. So you can start with any of those numbers that we're providing to call and talk with people who are experts in these ways. And also, as I said, we will have a Google Drive where there are additional resources you may be able to pull and share with your networks. Pedro, did we have another question you might want to address?
Yeah, and we definitely would like to thank State Representative Kristen Boggs, who asked that last question. And also she mentioned that any of the individuals on the panel are more than welcome to get in touch with her so she can also distribute those resources to her constituents. Another question comes from the chair of the Community Relations Commission, Chris Kozad, who asked someone if they could talk specifically about safety planning for the future for women who may not be in a place to get out during this pandemic, but want to be ready when they do feel they have the option.
Helen?
Yeah, so having a safety tips, it's important to have some kind of a safety plan. And there are things that you can address, such as, make sure that you're aware of where your abuser is. That can be, a very helpful thing. Trusting your instincts of the level of danger. Have a packed bag ready with clothes and, getting ready to go if you need to for imminent danger. Some other things is create like a code word as we were talking about. Let your children know how to call 911 in case, you can't. So having some also rehearsals and practice safety plans with your children in case it's needed. Those are some of the things. And also, if you are being attacked, one of the things in a self-defense class, you want to roll up into a very tight ball, maybe possibly in a corner where you're protecting your vital organs and things like that.
Anyone else? Yes. Okay, Sue, then Laura.
I just want to add, everything Helen said is spot on. I just want to add, when you're packing belongings in case you need to leave quickly, to make sure you pack your important documents if you are able to access them, so that you have birth certificates and shot records and things like that when you leave.
Laura, did you have something to add?
Yes, everything everyone else said, but also if you can do it safely, hiding knives and firearms that are in the house. There's been an increase in buying firearms. So if that's something you're able to do, I would say hide them.
And the last question I'd like to end with before final remarks from our moderator would be, if you could provide words of encouragement for individuals who are facing the threat of violence or know somebody who is facing the threat of violence, what words of encouragement would you give them?
Anyone? Yeah, Mary Lynn?
I just would say you are worthy of safety. You deserve safety, and people want to see that you're safe, and that's a human right, and you're entitled to it.
Meg?
I would say, I believe you. This is not your fault. There is help out there.
Anyone else? Sue?
I'd just like to add to what has already been said. is that help's available when you're ready. And that if you reach out for assistance, no one's going to force you or pressure you to take action that you're not ready for. We'll walk with you and we'll move at your pace.
Denise, did you have anything?
Yeah, I echo what everyone else has said. I would tell as a victim, you are valuable, you are worthy. Domestic violence is never your fault, it's the abuser's problem. And as Sue said, there are wonderful resources out there, and to never, never give up.
Yeah. Andrea?
Yeah, there were a couple of things I learned early on in working at a battered and abused women's shelter in Maryland. And one of the most important things was to never open a wound that you can't close. And I think sometimes when we go about doing this work with every bit of good intention, we need to allow for the time and the presence with that person. So I would always caution, don't open a wound that you can't close.
Yeah. Helen, thank you.
I would just add on to what everyone else has said, to create some kind of a ritual or mantra that you can say within yourself about being worthy and that you deserve to be happy.
Yeah, absolutely. And Laura, did you have anything?
Just to echo what everybody else said, I think all of that is great. And also recognizing the survival skills that you've already developed in order to get this far. You know, you might not recognize them as such. You might even think they're weaknesses, like compliance with that person when they become angry, but those are all survivor skills that you've developed, and you have those.
Well, that's a perfect way, I think, to end up, because I know I trip as I sit in these conversations. I know we all use the word victim, and I think what we really mean is survivor. Anyone who's experiencing this is already a survivor. Wherever you are in that journey, and those of you who are maybe experiencing it with someone that you want to help, you are surviving it as well. So please remember that you have strength in that, and that you have strength in so many of us from the community who want to help you. Please remember there are resources available, that we have all these numbers that are available. This video will be available on YouTube for you to access and access the information you may need to take down in the future. And with that, I'd like to thank all of you for being here today. And please know that despite the fact that we have a virus out there that's dangerous, domestic violence is just as dangerous. And if you are if you are in danger of physical harm, emotional harm, mental harm that is impacting your health, that is as important as this virus, and you need to seek help. And we're here for you. So thank you to all of you who've helped us to spread this message today. And I look forward to continuing the work with all of you moving forward. Thanks, everyone.